Regardless of age, anyone can develop Bell's palsy. Pregnant women and those with diabetes, the flu, a cold, or another upper respiratory condition are more likely to experience it. Before age 15 or after age 60, it's less frequent. An unexplained episode of facial muscular paralysis or weakening is known as Bell's palsy. Over the course of 48 hours, it gets increasingly worse. This disorder is brought on by facial nerve injury, the seventh cranial nerve, on the side of the face or head. Sir Charles Bell, who's credited with being the first to identify idiopathic facial paralysis in the early 19th century, is the name bearer of Bell's palsy. However, it was found that James Douglas and Nicholas Anton Friedrich came before him in the 18th century. Despite the fact that medical professionals from the Greek, Roman, Nestorian, Jewish, and Arab cultures made considerable contributions to our understanding of the illness, it was a Persian doctor who lived in the 9th century who provided the first thorough description of what is now known as Bell's palsy. Razi presented the initial work. In both his professional and academic endeavors, Razi held high esteem for moral conduct. He made a point of citing specific examples and being very fair. For later doctors, Razi's discoveries immediately became common knowledge. The most typical signs of Bell's palsy include headache, loss of feeling in the face, tearing, drooling, and disordered movement of the muscles that control facial expression, including smiling, squinting, blinking, or closing your eyes. You may also experience a loss of taste on your front two-thirds of the tongue, and the affected ear may be hypersensitive to sound. It's believed that the cause may be inflammation brought on by the immune system of the body attacking the nerves that control facial movement. Sometimes these conditions are linked to Bell's palsy. It could be diabetes, high blood pressure, an injury to the face, toxins, Lyme disease, sarcoidosis, Guillain-Barré syndrome, multiple sclerosis, infections, or more. With infections, particularly after a viral infection with the herpes simplex virus, which is related to the virus that causes the typical cold sore on the mouth, you too could also experience a flare-up of this palsy. Bell's palsy is not thought to be permanent, though. It can be occasional, and it may be persistent, although Bell's palsy does not yet have a known treatment. But typically, healing normally starts 2 to 6 months after the onset of the original symptoms. Patients with Bell's palsy typically regain full facial strength and expression. These are interesting things with JC.